have been struggling when it comes to addictions and mental health. The increase of stresses and the added isolation and pressures that are happening are causing people to kind of struggle with their mental health and substance use. Well, we've been able to pivot really rapidly with our programs to provide online and telemedicine-based supports. So we have counseling that's available through our mental health day programs, and our rapid access addiction medicine went primarily virtual at the beginning of the pandemic, with some face-to-face still happening, and we're in the phase right now of ramping up our face-to-face services at this time. The RAM clinics are a service that provides easy access to counseling as well as medical support for addictions. So we provide medication for withdrawal and anti-craving medications, as well as the counseling and social work that's necessary to help people maintain sobriety. So when somebody accesses the rapid access addiction medicine clinics, we start with an intake, which includes a real lengthy history and getting an idea of what each individual needs. We treat each individual uniquely and recognize that some people require more counseling or more medical support in their process. During the pandemic, we've seen rates stay fairly stable in regards to the amount of people accessing our services, but I think we have to take into consideration that for some people, accessing services has been more difficult. People are able to call us and refer themselves to the rapid access addiction medicine clinics. We would then set up an intake and again individually look at what each individual requires. We do not require a referral of any kind. It's a self-referral program. We accept referrals from medical professionals and hospitals. I think the advice that I would give somebody who's struggling with an addiction is to have an honest conversation with someone that they trust, whether that's a family member, a caregiver, a counselor, or their physician. There's many services available in our community. We're just one of them. Services are always confidential. And again, with the rapid access addiction medicine clinics, we are a readily accessible service as well. Recovery is very unique to each individual. So what each person requires to be successful and what each person would look at as success can be very different. Generally, we're looking at people needing a support system, and that's what we provide them is a really good, stable support system that's holistic and well-rounded, including counseling, social work, nurses, nurse practitioners, and physicians. I think it's important for people to recognize that they're not alone, that addiction not only includes substances, but a variety of other addictive behaviors, whether it's gambling, internet use, and TV has gone up, I'm sure, through the pandemic, and people are struggling in different ways and coping in different ways. Since opening, the Rapid Access Addiction Medicine Clinic has seen over 1,600 patients and providing about 600 visits a month, including, again, accessing counseling, medical support, and family counseling as well. And I think that's an important piece for people to remember is if somebody you care about is struggling with a substance use issue or an addiction, and he or she is not able or willing or in the place to access support at this time, then it's important to look at the support that's available to the family members.